I'm deciding to make this video for those of you out there who may be going through the same thing that I'm experiencing. I recently tore my distal bicep tendon off the bone, and I just wanted to put some information out there that might be helpful to others who are going through the same thing or who might be deciding to have surgery and what to expect. I know there's a few other videos out there that discuss what type of things they might go through. I'm hoping to provide you guys with information that will help you know what's normal and what to expect as far as sensations, feelings in your arm, and also the rehab process. I don't come from a pro sports background or any heavy bodybuilding background, but I do compete in the Scottish Highland Games, and that's how I injured this arm, my left arm, which happens to be my dominant arm, and that is the case for a lot of these injuries. It's usually your dominant arm. I was training for that and didn't give my body enough time to heal. I was probably doing too much too often, and that's probably what led up to this injury. I want to just give you guys a little bit of my background. I am a physical therapist, and which, yes, that's helpful having this kind of an injury, because I know some of the biomechanics and principles behind the rehab process. I have my doctorate degree in physical therapy. So my background is in sports and athletics. But even knowing those things, I still pushed myself to a breaking point. With that being said, this video will focus on some key points. The first one is that if you have torn your distal bicep tendon, keep in mind that there are positions for your arm that can be very compromising for your bicep tendon, especially if you're going to lift heavy. You hear a lot of guys actually injuring themselves when they're doing deadlifts or lifting something. If you are a heavy lifter and you've had this same thing happen, a lot of times it's because your positioning of your arm was in this pronated position rather than the supinated position. This position right here that you can see my left arm is in puts that bicep tendon, which attaches to your radius bone, in a stretched or tightened position. And then if you load that tendon even more when you're gripping and lifting something heavy, it will really put a load on that tendon. Sometimes it doesn't occur at the moment you're lifting something heavy, but over time you might be doing that, and then suddenly you go and lift something light and it comes off. As far as so that mechanism for injury, I would make sure you're paying attention to your body positioning when you're lifting heavy, especially if your forearm is in this pronated position and stretched out like this. If you're in that position frequently and lifting that way frequently, or lifting heavy objects that way, you could really overstress your biceps tendon. Second thing I wanted to talk about, I am about 2.5 weeks post-op. You can see here that they go in and made an incision on your forearm. the type of surgery I had, they go into your arm. They drill sort of a hole, makeshift hole in your radius. They go in and grab hold of that biceps tendon. They bring it down, and then they fasten it with an endo button. I kind of like to think of it as a drywall screw, where it kind of pops open once it's inside, or it angles it at a certain way so that it can't come back out. They attach that tendon into that device. So it's inside your bone. Keep in mind that anatomically, once it's healed up, will actually be stronger than it was even before the injury. So the outcomes for this are really, really good, as long as you don't have any strange complications, which are also very rare. So having the surgery, I wouldn't freak out about it. It's pretty standard, pretty smooth. It does take time to heal, and I will probably talk about that in a follow-up video. I wanted to talk about some of the things to expect in these first couple of weeks of the healing process, symptoms, pain, sensations, all that you're going to feel. For me, I didn't have a ton of pain, but I did have a lot of spasming, and the spasming was in my bicep. This occurred when the initial injury happened, but I also have a lot of spasms and shooting pains in my forearm coming down, going down towards my hand. Definitely a lot of swelling in the hand, which is pretty normal. The one thing to keep in mind as well, especially if you've recently had this surgery, and maybe your doctor or your therapist have already mentioned this, but you will have some altered sensation along the inside of your forearm. So in this area here, you're gonna have you might have some sensation loss initially, but that will actually come back as your arm heals up. My grip strength is coming back pretty fast. My wrist motion's coming back pretty fast. I am very limited with bending my elbow. As you can see, actively bending my elbow. As you can see, I'm wearing this elbow brace. This is pretty standard. This elbow brace locks my elbow to 30 degrees extension, so my elbow can only extend to this point right about here, and that's to protect the surgery. Extending out will put stress on that button inside the bone and potentially pull it out of place or detach, which you definitely don't want that. So my goal is to rehab as quickly as possible, of course, but to do it safely. So I am following standard protocols for the brace, the locking it at 30 degrees of extension. I am allowed to actively or passively flex my elbow, so I can use my hand and bend my elbow up as far as I want. I can unlock this brace and actively help pull my elbow up as far as I can bend it. I can actually take the brace off and pull that bicep or pull my wrist up towards my shoulder as far as I can, or as far as what I can tolerate. Right now I have pretty much full range of motion. I just can't actively flex that bicep right now. I have been doing some active assist help just to stimulate the bicep muscle itself without loading the tendon too much. That bone healing time, you're looking at about 6 to 8 weeks for a good solid bone healing time. So that's when you can really uh, look at being a little more aggressive with your rehab. But I would follow what your therapist and doctor are recommending, of course. Uh, the other thing that I would really try and work on is your pronation, supination. Well, I did that backwards. Pronation, supination movements. You can really scar down really fast and lose that motion, and that'll make it really hard for you to get back into your exercise and sports. Also, working on the wrist extension and wrist flexion movements will be very important as well. So I'm really working on my range of motion right now, just trying to get that going. Being cautious with my arm until I really get closer to that 6 to 8 week mark, where I know that bone has healed up around the button and the tendon itself. Other things to prepare for if you're having this kind of surgery, your doctor may have different protocols, recommendations, things like that. I would recommend just following the things they're telling you to do, and your physical therapist. If you go see a physical therapist, I would recommend going to a hand specialist, as they are a lot more familiar with these types of injuries and rehab processes. It might help you get back into what you want to do quicker. Other thing that's very, very important, and there's research studies out there that talk about this a little bit. This surgery doesn't or hasn't really been super painful. So I've been trying to minimize the medications that I use, and there's some solid studies out there that talk about avoiding the use of ibuprofen or Advil or things that are anti-inflammatory, as these will cause, or they can limit the inflammatory process, which in this type of injury is very beneficial for the healing of the tendon and bone junctions. So limiting that inflammation process could change or limit or slow down your potential healing, and maybe make your rehab slower. So my recommendation is to use those minimally, or at all, not at all. At this point, I haven't progressed to any strengthening activities. No resistance allowed, except for that active extension where I can push down into it. So if I am using my hand here, I can actually push down until the hinge locks into that 30 degrees, so I can push down against that. You just want to make sure you don't go past that 30 at this stage, as that puts your endo button and the tendon inside in a compromised position. For now, that's all I have. I just wanted to put this out there again, just to make sure you guys that are freaking out or wondering what to expect, that this is all pretty normal. You know, the shooting pains in your forearms, the cramps, the tightness, the aches and pains, the sharp, dull feelings that maybe, you know, all throughout that forearm, those are pretty normal. And one other thing, you're going to lose a lot of strength in your shoulder girdle, because you're not going to be wanting to actively lift that arm up, because you'll engage the bicep muscle. So me personally, this isn't as part of one of my exercise routine or my regimen, is I have been doing static resistance exercises against the wall for my shoulder. So that means leaning up against an item such as this desk and then actively pushing against it as if I'm elbowing somebody out this way. Keeping it down low in that protected position will help protect the bicep, but you can get a little stimulation back here on your shoulder girdle. I've already noticed some loss of muscle mass here, but also shrugs are great. I've already been going to the gym and working out my legs and my other arm, of course. There is some good research out there that supports some theories that if you exercise one side of your body, it can help stimulate the other side. For example, if I do bicep curls over here, I'm stimulating the nerve pathways in my spine that are going to cross over to this arm. But you get some of those chemical signals that can come over this way too, which can actually passively stimulate the nerves and the muscles on this side, which to me is a great benefit. You're increasing your blood flow, you're making it so those nutrients and oxygen are getting over to this side as well. So working your whole body, strongly recommend it. Don't be shy about getting up and moving around and doing stuff, as long as you keep this the surgery area in that protected position. If you have questions, I always recommend just asking that therapist or your doctor. All right, that's all I have for you. Thanks for watching this video. Feel free to comment if you have questions, and we'll catch you later.